Howdy, y'all. I'm Dr. Jeff Jarvis, and before we get into this video, I want to say congratulations to the Dodgers on winning the World Series. Turns out that hurts more than I thought it would. Congratulations. Walk-off grand slam to win the first game. Very exciting. But you know what would have been more exciting? If it had been the Astros or the Rangers. That would have been more exciting. But I think we can all agree the most important thing about the Dodgers winning the series, it's a new season, baby. Our chance is coming. Astros or the Rangers, we're going to get it this year. I can feel it. Can y'all feel it? I can feel it. One other thing about Texas A&M. I saw what Levi did, and, you know, it's okay to be a fan of your community college in Austin. It's okay. But we got some pride in our school, and speaking of that, congratulations to Michael from OMD. You got your ring today, buddy. Congratulations, gig 'em. Now, with that, let's get to some PRM, shall we? This PRM is about a new protocol that authorizes us to leave Narcan nasal spray with patients we feel could benefit from it. Now, that protocol ought to be coming out pretty soon, but in the meantime, I'm going to go ahead and issue a medical directive to cover it. Now, technically, we don't actually need a protocol because Texas law authorizes patients to get it straight from a pharmacist over the counter without a prescription. But my goal is to get more Narcan in the community, and if anybody feels uncomfortable doing it without a protocol, let's just fix that. One protocol coming up. Now, as y'all know, our nation is suffering through an epidemic of opioid abuse. In 2023, over 8 million people self-reported misusing opioids within the past year. CDC estimated there were over 81,000 deaths from an opioid last year, and in Texas, there were an estimated 2,000 deaths just from fentanyl, and we know that number doesn't include other opioids. Here in Fort Worth, we give Narcan to an overdose patient somewhere between 30 and 50 times a month. And here's the cool thing. Each time we give Narcan, Amy, with our MIH team, reaches out to the patient within 72 hours of the call. She and a drug and alcohol counselor try to meet with the patient if they're willing to provide some resources and get them into rehab. Now, there are very effective treatments for opioid abuse these days, but only if we can get them started. Amy is doing an amazing job with this population, and we want to give her, her colleagues, and most importantly, our patients, even more help by getting more Narcan out into the community. Now, we need to recognize that overdose is an indication of a larger substance abuse problem, and that patients we treat are at higher risk of death even after we've resuscitated them. In fact, a patient we successfully treat with naloxone has a 5 to 10% chance of dying from another overdose within the next year. Now, because we may not be able to get to these patients in time on their next overdose to resuscitate them, we can help their friends or their family save their lives by leaving them a box of Narcan nasal spray. So you're going to start seeing boxes of the nasal spray on the units sometime soon. There's going to be 4 boxes per unit in one of the blue shrink-wrapped bins. It should be the one with red tape on top. Now, just to be clear, this isn't the Narcan y'all draw up and give. It's the stuff meant for non-medical administration. Each box has 2 doses, and each dose has 4 milligrams of intranasal Narcan in them. Please give these out to any patient you give Narcan to, even if they go to the hospital with you. Don't assume that the hospital will give them Narcan to go home with. Just go ahead and give it to them. And here's the cool thing. Worst case scenario, you give them Narcan and the hospital gives them Narcan, and that's not a worst case scenario at all. That's actually really good. Now, they can't hurt themselves with this Narcan, and as a matter of fact, if they're self-administrating it, probably a good indication they don't need it, but they're not going to hurt them. You are literally giving them the tools that their friends or family need to save their lives. Speaking of which, feel free to give it directly to those friends or family. Basically, give it to anybody you feel could use it to save a life from someone with opioid overdose. So the box has instructions on how to use it inside. You just open the flap. There they are. But please review this with a patient or family to help encourage them to use it. Remind them they're not going to hurt anybody by giving Narcan. And also, please remind them that if they use it, they still need to call 911. Remember that the opioid the patient took may last longer than the Narcan, and they can overdose again or stop breathing again. Now, when you hand out one of these boxes, we want you to document it. We need that data to trend how much of the Narcan we're getting out into the community and where specifically it's going. The data that you put in helps us better target our interventions and lets us better help our community. So there's a spot specifically for this in Image Trend. It's just below the Procedures tab. You'll see yes, no boxes next to the question, was a naloxone Narcan kit provided? Now, if your answer to this is yes, you're going to see another question pop up asking how many boxes you gave them. Now, give out however many you think they need. Don't be stingy on this. This is one of the drugs we don't have a shortage of. We were fortunate to have grant funding for this project, and the goal of the project is to get the kits into the hands of whoever can use them. Keep in mind, y'all, this stuff isn't going to save any lives if it's sitting in a box unused in a warehouse or in Matt Wellen's office, just waiting to expire. It's got to get in the hands of people who can use it. Now, we're working with the Recovery Resource Council to get some stickers to put on these boxes, so what you're giving out may change a little bit. The stickers are going to have a QR code and a phone number where patients can get more resources. But don't let the box not having the sticker stop you from giving it out. Remember, a drug from a box without a sticker is still as effective as a drug with a box with a sticker. We like the sticker, but it's going to do more good than if you don't give it. So give it out there. Now, speaking of things we're working on building a program where we can initiate patients buprenorphine. Buprenorphine is a very effective treatment for opioid abuse disorder. You can help us develop this program by completing a CAL score in Image Trend anytime you see a patient you suspect of having opioid abuse disorder. This is a score, as y'all know, to help grade opioid withdrawal symptoms. Now, we typically say anybody with a score of 8 or higher is a candidate for bup therapy. You putting that data in helps us understand how many patients might benefit from the therapy in the future, and it helps us figure out the best way to deploy it in our system. I am really excited about the opportunity to provide these kits to our patients, to their friends and family, and I truly believe we have the ability to save a lot of lives by doing this. Please embrace this opportunity to use yet another tool in our toolbox to help serve our community. Guys, thanks for listening, and thanks for what y'all do every day. Take care, y'all.